really these type of things. So here's your chance to ask a number of questions. We hope to be here for another 15, maybe 30 minutes if we get enough questions. And what I tell people all the time is I look down a lot because I'm looking at my phone to let people know that I am actually asking their questions that they may have. I do not see us up as of right now on Facebook, but hopefully we will be up shortly. I'm going to hold on one second. Are we up? Because I don't see it on our. Tell me some things that caught your eye over the weekend as we sort of progress in the story.
So I would say specific to Colorado, a couple of notable things. No increase in the number of positive cases over the weekend, although we did get another positive case today. But that doesn't surprise me because we're still in the flat part of the curve where it will take a little bit of time for the number of positive cases to go up. The other thing that came up over the weekend was whether we're using our testing capacities enough. And I think we still are kind of growing into what we should be doing. The CDC has released some revised criteria for testing, but certainly I think as time goes on, we're going to see an increase in the number of tests, and that will certainly help us to detect more cases of the virus as well.
From Larimer County has been diagnosed with pneumonia. A CDPHE and local health agencies are working to gather more information and contact any individuals who had close contact with this patient. That's the normal thing that's taking place right now, right?
So do we know if she traveled outside the country?
Don't know.
Okay, so she could possibly be a case of community spread, potentially the first one.
And there's a lot of interest in Pitkin County right now where there were a number of people that were in contact with a woman who now is back in Australia who was since tested positive. So there's going to be a lot of interest in that case as well. One more thing before we continue on. Any thoughts?
Hey Chris, keep talking.
Yeah.
Live on the website.
Okay. Okay. So we're live on the website, so people can watch us on the website. They can't yet watch us on Facebook yet. Hopefully we'll change that fairly shortly. What I wanted to talk about was this idea of testing in general. We've talked a lot about testing. Clearly the state has a capacity right now, if they really do everything they can, to do about 160 tests a day. It's obvious right now the state is doing nowhere near that. Colorado is certainly not the only state that is really having an issue in terms of ramping up its testing capability.
Community transmission, it's also partly because we're not looking for those.
That seems to be, there almost seemed to be some confidence from the city of Denver. And one thing I want to be clear on, we don't have any evidence to suggest otherwise. But there was maybe particularly an unnecessary level of confidence from the city of Denver suggesting there's no cases of community spread. I don't think anybody can go on the record and say that definitively.
Absolutely not, yeah. We know this virus is capable of community spread. It's demonstrated that in multiple other communities, Asia, United States, Europe, and so I don't think it's easy to make that conclusion, especially with the current way that we're testing.
Is it just that the criteria is so narrow, or at least it has been? The criteria changed last night from CDC, but the criteria up until now has been so narrow that we're really only finding people like who raise their hand and say, I was in Wuhan, or I was in Italy, northern Italy. Hold on one second. We're now on Facebook, so thank you. Thanks for bearing with us for a second. So we may start over just a little bit, but the criteria used right now to test people has been if you've been to an area,
right,
or if you're like on a ventilator and you're in serious need of trouble and you knew some. The criteria was so sort of specific that we were only testing a very small number of people.
So the criteria require both symptoms and exposure. So you have to have fever, cough, and shortness of breath, or some combination of those, and either directly have gone to an area or be exposed to somebody who tested positive for COVID virus. The only way that you can get out of being exposed to somebody is if you're on your deathbed, on a ventilator, extremely sick in the hospital, and there's no other explanation.
And here's what I think is interesting. If everything that we know about the virus is true, that 80% of people have very mild or no symptoms, that those people, we have 80% of the population. So if we're just testing a small number, we're only scratching the surface of what's potential in the community, are we not?
Exactly right. And those 81% of people, they themselves may not have bad complications, but they are vectors. They're running around potentially transmitting the virus to more vulnerable members of our society, like the elderly or those that have chronic conditions. And so that's really the problem. Is there's two reasons we test. One is for diagnosis, and the other is to help understand the behaviors of the virus. In this case, the diagnosis is almost less important because we don't really have any targeted treatments towards the disease, so it's going to run its course regardless.
Right.
So the reason that we really should be testing in this case is really to try to help contain or mitigate the impact of the virus, to understand how it's spreading in our community.
Well, you don't. Here's the thing, and I got off the phone with a doctor not too long ago who is sort of who talks about seeing patients within the last couple of weeks that she had to turn away, that she not turn away from her practice, but turn away from the test because those patients of hers didn't fit the criteria. And what she worries about is that those patients potentially could have had it, weren't candidates, and now just were free to move around the community. That's concerning.
That is very concerning. And the other thing I would add is that this virus is incompletely understood at this time. So we don't know the behavior of the virus. Could it be mutating? Could it be changing in the way that it's presenting its symptoms? And therefore, we need to find out as much as we can. And the way we're going to do that is through testing. So again, I know the state is trying to be judicious with its use of resources, but at this point, where we're nowhere near capacity with our testing, I think it seems most prudent to over-test, even if you end up getting a bunch of negatives, because that'll help us understand the science.
There is an expectation from the state that by the end of the week we will reach capacity of 160, and then there is this optimism. There's clearly going to be an influx of tests from the federal government. They announced that this morning, and that they will be probably, maybe not even by the end of this week, but sometime next week, that we'll have the ability to test even more. There's a reliance upon hospitals being able to do these tests, other places, because right now, physically, you have to get the test probably in an ER, and then that test has to go to the state lab. The state lab then confirms, or if it's positive or negative, and then it sends CDC. In the meantime, somebody from the state, CDPHE, then contacts that person through their physician and says, you are positive for this. Now give us a history of everyone you've had contact with since you've shown symptoms. That's a laborious process that we've probably got to get a lot better at.
We do, because like as you pointed out, as the number of cases increase, we'll have to do that. The other thing I want to comment at this point is, rather than looking back, we need to look forward. So up until now, we had really been focusing on containment efforts. So we were talking about source control and tracing back contacts. I think there's really been a large shift over the weekend based on the way the virus is behaving, where we're now thinking more about mitigation. How do we minimize the impact of this virus? So rather than necessarily tracing back everyone's contacts, we're now thinking about how do we now prevent this person from infecting new people, or prevent other people around this person from infecting others.
Everyone who I've talked to who's on the front lines of this says there is an expectation that there is, and this is not to panic people because they don't believe it's widespread, but they believe there is some community spread taking place.
And
You've said the same thing.
the assumption would be yes, because it's happened in every other community, so why wouldn't it happen here? And we're just not seeing it because the numbers are not big enough, so we haven't detected it. But as those numbers get big enough, I suspect we will.
And the interesting thing is we're going to be testing more, so we're going to find more cases.
Yeah.
Debbie Johns, how does someone know if they are no longer contagious?
So good question, Debbie. So in general, we think this virus behaves like most other viruses. In other words, once you finish your symptoms and the symptoms have resolved, you're suspected to no longer be contagious. Having said that, there has been some evidence that some people may still have viral particles in their respiratory droplets up to several weeks after their symptoms resolve. We don't know at this time whether those particles are still contagious or not. So what the protocol has essentially been is that after somebody's symptoms resolve, we then test them again to see if they still have enough viral load to show up positive on the test. And if the answer is no, then we believe that they're no longer contagious.
Kristen asks, why do we not see kids getting this?
That's poorly understood. There's a few hypotheses as to why. One is that kids have a relative immunity to the virus. So in other words, they only present with mild symptoms and don't have that full-blown inflammatory response that leads to complications. The second theory is that kids may have a slightly lower rate of exposure because they're not out in the community as much, handshakes and things like that. And then the third theory is the reason that kids are lower risk is because something about the virus that it doesn't infect kids.
Let's go to there's some of these questions I'm trying to get to some new questions. They say they can barely hear you, so I want to make sure that you talk up. I think we should be good, but I'll see if we hear anything more of that.
I'll try to turn up the volume a little bit.
Let's talk about. Let me check the bottom. Can we hear her audio?
Hello?
Chris keeps touching his face. I'm really sorry about that. This is just so obnoxious of me to do that. But I want to ask you about this, but I'm going to answer it first. Sonia asks, I want to know why the media is blowing this out of aspect, surely to drive down the market with an upcoming election, no doubt. I would suggest, Sonia, to talk to some clinicians in your life. And maybe you have, maybe you haven't. I think what we're trying, this is in no one's best interest to scare people. I have no interest in scaring people. I have a family. I have a daughter. I have absolutely no interest. I have money in the stock market. There is nothing that benefits me by things falling apart the way that they have. Excuse me, I'm coughing into my arm. I have a cough. It's not necessary. I'm not showing any signs. I know.
Over here.
But from my perspective, I think the public is entitled to facts. And that's what we're trying to do. Now, clearly this is a disease with a lot of unknown components to it. And that's why we're bringing in people such as you. I mean, you went to school for these things. You understand this much better than I ever will. That's why we want to ask you questions. But I want to get your thoughts on, do you believe, this is a totally loaded question, so I'm going to apologize in advance, but do you believe that the media is blowing this out of proportion?
You know, I don't. And as a physician, I have to reemphasize what you said, that our best defense against this virus at this point is information. And because there's so many unknowns, this is a global emergency of relatively high magnitude. I mean, this virus kills people, and so it is important for us to stay informed. And that's why I think that information is power, and the more that we can educate people about the virus and its effects, the more they can make intelligent choices, because they're not just passive participants, they're active participants in how the virus spreads. And that's part of the goal here with the media, is to educate people so that they can help us fight this thing and slow down the spread.
I'd be more than happy to report that this thing is over with in a week.
Right.
I'd be jumping for joy, and I'd be totally fine with that. I think some things that we have really tried here, and this is your opportunity. If we're not leading, I mean, we said this a few nights ago, last week, and I firmly believe in it. If we're doing reporting that you specifically have problems with, we would encourage you to get in contact with. You can email me at chris@9news.com. You can always let us, that's chris@9news.com. You can always let us know when our reporting falls short of your expectations. But I think, like, we've talked a lot. People talk about, why don't you talk about the flu? We've talked an awful lot about the flu. Yeah. Right now, the flu has killed considerably more people, a significantly larger number of people than COVID has. And hopefully it stays that way. We've talked about the flu. We've talked about other things. But the issue is not what it's done, but what the potential is.
Exactly. And what we can do to change that. And we can stay educated and informed, I think.
Can we fight this infection off without hospitalization?
Most adults will, in fact, so yes.
80%, right? I mean, we're talking about a sizable number of people.
81%, 19% will require hospitalization.
And the younger and healthier you are, the better your odds are going to be. Already your odds are good, but, you know,
yes,
the better your odds are.
It's an age-dependent thing. So as you get older, the risk increases in a direct correlative fashion.
Leslie, confirmed case in Larimer County now. How likely is it that schools close? I'll take a stab at that first. I don't think we're there yet.
I don't think so. And in fact, medical experts have said that school closings is probably one of the least effective ways to mitigate this virus. And the reason being because the rate of infection amongst kids is much lower. In fact, they've also suggested that closing schools places undue burden on parents, many of which are healthcare workers. And so it's actually probably not the best approach at this time.
And I think what you're seeing so far here in Colorado, because there's been some schools down here in the Denver area that are impacted by all this, is that there's a tendency to maybe close short term, do a lot of washing of the facility, cleaning of the facility as much as you can, and then come back. But there is not, we're not expecting right now to see any widespread school closures.
Now, of course, in places like Italy, New Delhi, South Korea, it's an effective way because the number of people that are infected is so high. But certainly here, with the number of cases we have, that's not where we are yet.
Do we know if this affects pets?
Another important question. So coronavirus is part of a family of viruses that normally was thought to infect animals. And the current guidelines by the CDC are that if you suspect that you may have COVID-19, of course you put on a mask right away to protect your family members, but you also don't interact with your pets because we don't know yet whether or not this can potentially affect your pets. We don't think it can, but we don't have evidence yet.
Kelly, I am one who is immunocompromised, having lupus, and have a splenectomy. I plan on flying to Boston tomorrow. I'm wondering if I should be overly concerned about travel, as my family says I should be.
Yes, Kelly, I'm worried for you because if traveling does increase your risk of contracting this virus, particularly to areas that have it. And Massachusetts, I believe, does have some cases. And of course, being on the airplane and at the airport where there are a lot of people congregating. So when you're immunocompromised, your ability to fight off the infection or to have secondary infections once you get infected with this virus is pretty high. So it worries me, but the decision at the end of the day really has to be yours depending on how important this trip is.
There's a lot of talk about toilet paper, which seems humorous in the front end until you need to go to a store and need some. There has certainly been a run on some things at some isolated. I didn't see any. I was at my grocery store over the weekend. I didn't see any sort of massive shortages of anything.
You got your toilet paper.
But I was fine with that. We're good to go. But stockpiling there's a limit to stockpiling where it's not necessary.
Right.
Now.
So I think we've taken it to the extreme. The idea when you heard it, whether it was on the news or you read about it online, was really to help you get prepared in case we get to the eventuality where there's either need for social isolation, as we call it, meaning the government or the CDC says everybody stay in your houses for 2 weeks or 4 weeks in order to prevent the spread of this virus. Or secondary, if there's a supply chain disruption, meaning we can't get the products because the companies in China or wherever that manufacture them aren't able to provide them. I think we've taken it a little bit to the extreme, and I think people are stockpiling months and months worth of supplies. And at this point, I do believe for a virus that has an incubation period of only 2 weeks, that's a little bit too much.
Well, I mean, there is a point where we all collectively need to take a deep breath.
Right.
And I mean, there's a lot of scary things have been taking place just today with the stock market.
Yeah.
It's probably benefits everyone to just take a deep breath.
Right.
Arm yourself with knowledge as opposed to speculation. Noel asked, my family and I were really sick with pneumonia in late November. Is there a possibility we had this virus and they just didn't have a name for it yet?
It depends if you travel to Wuhan, but the first reported cases of the virus were in December in China. So it's always possible, but
It's
probably
extremely unlikely. Yeah, I would say
Probably
extremely
very
unlikely. Tourism money seems to be more important than the safety of people who spend the money. That is alarming. Jennifer, that's an interesting point. I think mayors and governors and business leaders are going to have to sort of contemplate that issue.
Well, I think they have to make some tough decisions because we don't want our economy to spiral. We don't want our way of life to be lost. But at the same time, we are in the midst of a public health emergency.
Do you know if this can cause permanent respiratory damage from Debbie?
So for the majority of people, there are no permanent sequelae as far as we know. But again, we've only known this virus since December. So we don't know what it might do 5 or 10 years down the line. We do know that people who are smokers, such as the men in China who smoke, may have had a higher risk of complications from the virus as well. And they may or may not have had some permanent problems as a result of the virus. But for the vast majority of adults who get this, they'll recover from it probably uneventfully and not have any long-term.
I suppose some people are going to not even very mild symptoms.
Yeah, it
Maybe
might
not
just
even
feel like a cold or maybe nothing at all. Some people have no symptoms at all.
Amanda, originally I read your article that said do not avoid large gatherings, and now it's been updated to say avoid large gatherings. What's the guidance there?
Yeah, so great question, Amanda. And I think when I said don't avoid large gatherings was when it wasn't here in Colorado. And so there was no reason for us to be changing our social behaviors. But now that it's here, even the healthy people who go to large gatherings, even though they themselves will have a very low risk because they're healthy and unlikely to have long-term complications, they are vectors, or they are basically serving as a way to transmit the virus to other members of society. So we all as a community now have to really work together to try to control the spread of it here in Colorado now that it's here.
It's such an interesting thought because we have really fractured as a society over the last few years, and we can't agree on anything. It seems like these days, but
Right.
if there's something we all need to agree on, it's like we're all in this together.
This really unites us, and I think rather than focusing on all the horrible things that it's doing to our economy, we really need to think about this as, regardless of race, age, gender, socioeconomic status, we're all in this together, and we have a common enemy, and I think we need to band together to really defeat it in this case.
Tim, I'm flying to LA this weekend. I've thought about bringing a pair of gloves for the flight. And while I'm in an airport in an Uber car, I've heard that some say it's not a good idea to wear gloves. Is that true?
There's been no evidence that gloves can prevent the transmission of the virus, and sometimes if you wear gloves, you may be less likely to wash your hands. So there's no data supporting the use of gloves at this time. If you are going to use gloves, you probably can, but make sure that when you take them on or off, you wash your hands. Make sure you don't touch your face with the gloves, which people tend to do.
Teresa, any work on antivirals to potentially treat this virus or decrease the severity and length of illness?
So there are a couple of clinical trials ongoing in China right now looking at many different antiviral therapies, and they are not yet reported out what the success of those therapies is, but they're certainly in clinical trials at this point.
Jennifer brings up something. We talked about this early before the Facebook Live started, but I want to bring this up because I think it's really important. It's been top of mind. We don't know the numbers. No tests, no numbers. Let's go over this issue again, because when you're not testing in large numbers, you really don't have any idea what the virus is doing.
Right. It's like taking your own pulse. If you don't put your hand on your other wrist and check, you're not going to know exactly what's going on inside. And I think that's the situation we're in right now. We're only going to find what we're looking for. And the criteria as they stand at this point are only testing people who've had direct exposure or people who are critically ill. So if you don't fall into one of those two categories and you're one of those cases of community spread, we're not going to be able to find out.
Lindsay, why are they not telling us where the confirmed cases have been? Public health should share areas that their patients have been once their symptoms show. There's a really interesting dynamic, because I remember with the first case, they didn't even want to say where that person had been, even though there was a widespread assumption that, like, they're visiting Colorado in the winter in Summit County. I mean, there's a better than average chance they were skiing. And then eventually comes out that they were skiing.
Right.
There is patient privacy, which is important. We have laws with regards to that. But there's also sort of a public expectation to want to know everything about where that person was. Where do you think we draw the line?
I mean, and the other thing I would add to that is the efficacy at this point, again, of looking backwards rather than looking forward. Does it really make sense for us to follow every single step that person took at this time and invest those resources? Probably not, because there's not much we can do to change the course of who they may have infected. What makes more sense is to look forward and make sure that they are not continuing to spread the infection. So that's one of the reasons that public health efforts have really focused rather than looking at the source, because we're beyond that containment. We're beyond that point where we're trying to really contain the virus. We're now thinking about how to mitigate it or how to minimize its impact. So instead of looking to where they've been, we look to where they're going.
Nora, coronavirus comes with a fever. How high of a temperature are you saying?
So it's been variable in the clinical studies. In fact, a few percentage of people had no temperature at all, but the majority of patients did experience a temperature. Some actually said they experienced the fever symptoms within the first week, which was low grade, and then it went to a high grade fever, and others said that it came right away. So the short answer is it's variable. If you have any temperature, whether it's low grade, which is considered less than 100.4, or normal or high temperature, you need to seek medical care.
Christy, don't believe everything you hear on social media news. People use common sense to keep yourself and your family safe. I would reiterate that, even though she's referencing news people. I mean, I think, look, we are our best arbiters of the truth when it comes to our own families and our own decisions. I would highly urge people to sort of listen to folks such as yourself. And we are doing our darndest to try to give a comprehensive view of what you need to know as a family. We may fall short from time to time. And when we do fall short, it's okay for you to tell us. I said this earlier in the live shot. Chris@9news.com. Email me if there's something specific that you're taking an issue of what we're reporting. I mean, what I don't want to hear is sort of like, you're just lying to people. Like, tell me specifically what you think we're lying about, and we can address it. But that sort of blanket statement really doesn't do anybody a whole lot of good. Okay, rant over. How many deaths have there been to secondary infections?
Great question. Looking at some of the studies, it looks like the minority of deaths is due to secondary infection and the majority of deaths is due to the pneumonia caused by the virus itself. But some people can get secondary infections.
Have to travel to southern climate. Is the virus spreading to be, is appearing to be less tolerant in warmer weather? And then also largest exposure on aircraft, airport, yes, question mark?
So we're hopeful that the virus activity will go down in warmer weather, but what we have seen thus far, whether it's in Singapore or Australia or in South America where the weather is warmer, is that does not appear to be changing the infectiousness of the virus. We call that the R naught value. The number of people that one person infected with the virus can infect does not seem to be altered based on the weather at this point.
It's a bummer.
But how long the virus survives on surfaces
Sure.
is highly temperature dependent. And so that may actually be variable depending on what the ambient temperature is.
Does keeping your immune system up with orange juice, vitamin C, or anything help with preventing the virus?
So vitamin C gained a lot of interest because if you're vitamin C deficient, it can actually increase your susceptibility to pneumonia. Having said that, there's very limited evidence that supplementation with vitamin C is going to prevent infection with the virus or decrease the response to the virus. There is a clinical trial ongoing in China right now where intravenous vitamin C is being given as part of the treatment regimen for the virus to see if it can shorten the amount of time that people are in the ICU or on the ventilator. But again, these are people very far advanced in the stage of the disease. So,
But now is always a good time to start treating yourself well.
I think the healthier
Don't put that
you
off.
are, yeah, the healthier you are, the better. And that means, drinking alcohol in moderation, staying hydrated, making sure you're getting enough sleep. All of those things are going to boost your immune system. And if you're vitamin deficient or feel like your diet is not well balanced, then it may make sense to supplement your diet with vitamins.
If someone, you kind of referenced this, but I'll get more specific, get very specific. If someone with COVID-19, say, sneezes on a countertop and walks away, how long will that virus stay alive on the countertop and continue to be dangerous for transmission?
So that depends a lot.
Excuse me, but I'm kidding. It's a bad
That
joke.
depends a lot on the ambient temperature conditions. In fact, they say that if you actually put the virus on a surface and put a drop of mucus next to it, a booger basically next to it, it actually extends the amount of time that the virus lasts on the surface.
Oh, great.
So we don't actually know exactly how long it lasts, but our best estimate is several days at this point.
It's a long time, potentially. That's why we want you to clean things.
To wipe everything down, exactly right.
I've cleaned my phone like 4 times
But
today.
and remember, it's not going to jump off the surface and get into your nasal passages. You have to inoculate it. So touching things and then touching your face is the way that it really gets into your nose and mouth.
I have to go in about 3 minutes. I'm going to try to get to as many questions as we can. How about drive-up testing facilities once the testing capacity is increased? They're doing this in South Korea. Stay tuned. I think there's some news to be had on that fairly shortly, but we're looking to confirm that with the state of Colorado. How about just telling us the age and health of those that have died rather than just saying there are deaths? I think we've been, we have not had deaths in the state of Colorado.
We have not had deaths here. The studies from China of the large patient population show that there have been deaths at every age. So every age group, whether it's children or adults or older adults, have some risk of mortality. But again, the highest risk is in those older population. And what I mean by older, because somebody asked this too, is one study defined it as greater than 65 and one defined it as greater than 70. But as the older you get, the higher your risk.
Lisa, I'll leave this and ask this last question. Are people with asthma at an increased risk? I'm a healthy 37-year-old, but do have very controlled asthma.
People with asthma are at increased risk because it's considered a lung disease, and this is a respiratory virus. So if it gets into your lungs and you have asthma or bronchospasm, it can certainly make it much more difficult to get that oxygen in.
Thank you.
Thank you.
Once again, thank you so much for your expertise, and thanks everyone for joining us. It's very much appreciated. We really appreciate the open discourse with everybody and the questions. Even the toilet paper questions are good questions. I think this is what the time for all of us. As we said earlier, we're all in this together.
We are.
And we're all sort of finding out. This is a new avenue for our newsroom. We're going over plans of what we're going to do, what contingencies we need to be ready for. This is a new unexplored territory for everybody. And hopefully the more you can arm yourself with information, the more comfortable you feel. We're not trying to scare people. We're not trying to convince people that they should never go outside and that we're all doomed. I don't believe that, but I think we should protect ourselves with information. Protect yourselves, protect your family, and then realize we're all in this together.
Yes.
Good way of saying it, maybe. I don't know. Who knows? Thanks so much. We're gonna try to keep this regular somewhere time after our new newscast every day. But thanks, Dr. Kohli, for joining us. Varying things. People saying, "Oh, we're good," and other people said, "We're not good." But then most people were saying we're good. Okay, good.